Okay. Hello, everybody. My name is Ree McLaurin. I'm the Chair of the Board of Health, and I'm calling the meeting to order. Our first um, agenda item is to review the agenda, and I'm just wondering if anybody has anything they'd like to add as a revision or an addition. Okay. Hearing none, we'll move on to number 2, the minutes. Wondering if I'm going to give everybody a few minutes to just look through the minutes from the August 22nd meeting, and then you can let me know if you have any additions or revisions. Anybody need more time? Okay. Hearing no additions or edits, the minutes are approved as written. And we can move right into our next section, our on-site wastewater variance hearing with Chase Godeke.
And this, we have Jay with us today as our staff person that will help to get the presentation started. Can you hear us okay, Jay? You good to go?
Yes. Can you hear me?
Yes.
Yeah, and we had to move to my computer. I was not able to get internet connection in the boardroom. So if you hear some background noise, it's other people on the phone.
Yeah, they should be 24 to 36.
Okay, thanks for that. Thanks for making it work for us, Jay. Take it away.
Okay, well,
Yeah.
we were looking at a variance to the regulations for the Lewis and Clark County on-site wastewater regulations. I'm just going to basically read through the staff report, give you kind of a brief rundown, and then Mr. Frank Prescar from Casney and Associates will give his rundown also of what they are presenting to do. So, but
No problem.
basically this variance is by the property owners Chase and Elliot Godecki, and they live at 3678 Flowery Drive. Actually, that is a property proposed with the variance. The variance request is for section 4.35 of the wastewater treatment regulations, which states that wastewater treatment systems must be located to maximize the vertical separation distance from the bottom of the absorption trench to the seasonally high groundwater level, bedrock, or any other limiting layer. But under no circumstances may this vertical separation be less than 4 feet of natural soil. So that would be for any new members, that is what they are requesting the variance to in our wastewater treatment regulations. Briefly, 3678 Flowery Drive is a 44.7 acre tract of land. The lot was created in 1989. It's located east of Flowery Drive, north of York Road in the Helena Valley. So if you go out York Road, east of town, it would be north of that. The lot is over 20 acres in size, so is not subject to the Sanitation Subdivision Act, which would require they go through review with the state DEQ. And currently the lot is undeveloped. The property historically has been used for agricultural purposes, hay ground, so on and so forth. Numerous hydraulic features are in the area, such as shallow groundwater, some surface water areas. Prickly Pear Creek runs from the south to the northeast on the lot, flows north towards Lake Helena. It is approximately 0.3 miles directly west of the proposed system. And based on USGS, US Geological Survey data, the direction of groundwater flow is basically north from this point. Okay? And groundwater flow is assumed to intercept the creek approximately half mile from this where the proposed drain field would be. There is floodplain in the area, but it is over a half mile away from this proposed site. We have done groundwater monitoring on the parcel this last spring and summer of 2024. 4 monitoring wells were installed on the site, and it needs to be noted that all 4 wells did peak at less than 4 feet of groundwater. So they all 4 did fail. The shallowest level recorded on the lot was at 1.85 feet. And that was on the well number 2. The area that they're proposing to put the drain field would be located near well number 3, and that peaked at 2.3 feet below the ground surface. And again, according to Lewis and Clark on-site wastewater treatment regulations, section 4.35, the system must be located to maximize vertical separation distances from the bottom of the absorption trench. And at no time may it be less than 4 feet of below 4 feet of natural soil. So we also, at that time, or in the January of 2024, excuse me, we did do a site evaluation. Myself, I looked at the test holes that were dug in those areas. Soils at the site are basically silty clay loam with about 0 to 10% gravel content. So this soil typically does provide good wastewater treatment. We did have groundwater in the holes at the site at 78 inches below the ground surface at that time. As I noted at present, there are no downgrading wells for over a half mile in the direction of groundwater flow. Okay, the proposed well for the lot will be approximately 600 feet east of the elevated sand mound, which is the type of system that is proposed. So parcel is not subject to non-degradation requirements for the Montana Water Quality Act. Nitrate sensitivity and phosphorus breakthrough basically were calculated, and they were determined to meet non-degradation standards. So as noted, the proposed treatment system will not cause nitrogen and phosphorus in the ground level to exceed the regulatory limits according to those calculations. Okay. The applicant is proposing to install a septic tank with a level 2 nitrogen reducing system for pre-treatment. This would discharge effluent to an elevated sand mound, which would be built up above the ground surface. And the applicant is proposing to construct 1.7 feet of stabilized fill. So they would bring in fill, build it up above the ground surface, and construct that elevated sand mound above that. This would provide more than 4 feet of soil prior to the placement of the elevated sand mound. The proposed system will serve a single family living unit and a shop with living quarters. Each living unit, the shop and the house, is proposed to have an individual septic tank. So in Montana, level 2 wastewater treatment system must demonstrate that it can reliably remove at least 60% of the total nitrogen from the wastewater. And the elevated sand mound does not remove as much nitrogen as level 2, but it has been proven to remove a great deal of total suspended solids and biological oxygen demand, as well as bacteria. And it is proposed the system would be designed by a professional engineer, and tank buoyancy calculations would be calculated to ensure the tanks do not float due to high groundwater. It also, as I noted in my staff report, 2 similar variances were granted, in the past, one in August of 2022 and one in October of 22 for the two lots directly north of this particular lot on Flowery Drive. The location of these parcels basically, they face similar situations. They both had high groundwater that exceeded that 4 foot limit, so they all failed. The applicant is proposing similar type of systems, level 2 with elevated sand mound. Both those variances were approved by the Board of Health. Currently, there are no other options as far as easement on neighboring lots. And it should be noted that neighboring lots also have high groundwater that would not pass. So in conclusion, that's I can turn this over to Mr. Preskar. He can give you any further updates and information. Okay, great.
Thank you, Madam Chairman, members of the board. As Jay stated, my name is Frank Preskar. I'm employed by Kasdan Associates here in Helena. Mr. Gadecki, yes, has a lovely parcel that has some challenges, namely depths to groundwater. As Jay mentioned, groundwater monitoring was completed on the parcel at 4 different locations. Test well number 3 did provide the greatest amount of natural separation, and that's why we are proposing to place the disposal system at that site. Jay actually took most of my thunder, but I'll follow up on a few things. The 4 feet of separation is established, I believe, to provide adequate treatment of wastewater before it interacts with ground and surface waters. This site, we don't have that naturally occurring, but I do believe the technology is available to provide at least, if not greater treatment than 4 feet of soil. And a couple of things go into that opinion that I have for this site. As Jay noted, the surface soils that we do have are silty clay loams, which are fairly fine grained soil, as compared to a large portion of the Helena Valley that's coarse sands and gravels. So these soils, what we do have, a little over 2 feet, will provide a great deal of treatment on their own. However, in this case, we're going to import a similar textured soil to achieve 4 feet of separation from groundwater. So about 1.7 feet of fill will be placed at that site, on top of which we'll place an elevated sand mound. As Jay stated, sand mounds have been around for quite a while, and they do provide a higher level of treatment than a standard drain field would. They're not considered a level 2 system or any of those things, but they do provide quite a bit of reduction in BOD, suspended solids, bacterial and viral load. That system is pressure dosed, so it provides uniform distribution, provides extended lifespan of the system over something that is gravity fed. So those 2 units will be located at monitoring well 3. The level 2 treatment system will be located closer to the home. It's a sealed unit. At this point, like I noted in my report, we're recommending an EcoPod. It's a fixed film, and I did provide some information. I won't go into a lot of the details, but there is some information in the packet about the treatment capabilities of that particular unit. We would, however, like to reserve the flexibility to utilize any of the level 2 systems approved by DEQ at this point. Like everything right now, costs on some of these proprietary units are fluctuating quite a bit, and would like the ability to shop around for the system that we'll use. As Jay mentioned, a level 2 unit has to verify to the state of Montana that they can remove at least 60% of the nitrogen from the waste stream. Depending on the unit, they typically have other treatment capabilities in there. Again, typically BOD and suspended solids are greatly reduced. The EcoPod specifically has an NSF, or National Sanitation Foundation, certification for removal of those 2 constituents. So that is with those three additional factors, we believe that a treatment can be achieved that will protect state waters. That they will not degrade any of our state waters. They won't pollute or contaminate any of our surface waters. We're fortunate in that the Helena Valley aquifer has been studied quite extensively, and we do have fairly accurate gradient and conductivity values for our aquifer. So based on those studies, we're able to establish a groundwater flow direction and the velocity or the amount of flow that is available in the aquifer in this area. As Jay noted, from that study, the groundwater flow direction, the first surface water we'll interact with is Prickly Pear Creek, a little over a half-mile down gradient. So that factors into the trigger value calculations that we did. We've also done the nitrate sensitivity and phosphorus breakthrough calculations. And as Jay mentioned, this system will keep both of those constituents below regulatory levels. So we won't be doing any of that. This system, like all systems within the state, will be designed for the maximum daily flow for the home and the secondary dwelling unit in the shop. And it'll be sized based on those maximum daily flows. All of the components for this system, the tanks will have sealed lids. The rest of the components will have a minimum of 12 inches of fill over the top of them. So there won't be any access for rodents or humans or any vectors to make contact with that and cause a health threat. The other part of it, pardon me, as Jay mentioned, we looked at what alternatives might be available in the area. There are no public systems readily available that would have capacity to cook to. The general surrounding area within a reasonable distance basically has, as Jay mentioned, the same issues of shallow groundwater tables and or floodplains, depending on which direction you're looking. So we really don't have any other feasible alternatives for this property other than an on-site system with a variance from you folks. When the parcel was created back in '89, because of the size of the parcel, there was no requirement for a formal review of the environmental conditions on the property. And even today, the property can be bought, sold as it is without any formal review. The Gadeckis did request that review when they decided to start developing this property, which is when we discovered that we could not meet that 4 feet of separation. So that will create a bit of a hardship for them if they're not able to develop this property. Like I said, I think Jay pretty well covered a lot of the other parts of my report that I was going to give. If there are any questions, I'd be more than happy to answer them.
Thank you so much for the presentation. Commissioner Payne, it looks like you might have had a question.
Oh, there. Technology is always challenging for me. I have two questions. I was wondering about the ownership of the property. The application, I just saw it at the top of the page. Pardon me. Well, while I'm finding this, what is the expectation of further subdivision of this lot? It's a 40-acre lot. And, eventually people think we need to have more places for the grandchildren to live. Can you address that?
I believe Mr. Gadecki was going to join us. I cannot answer that.
I can answer that.
There you go.
Frank.
Chase is on. There you go.
Candace, yeah, I mean, our expectation of this property is to have it as our
there he is.
primary residence. We don't really have any expectations to do any sort of additional subdivisions or properties. In the future, right now, we're gonna build the shop with the living quarters, hopefully, and move there and then potentially build a house for ourselves in the future. So we don't have any expectations to develop this land beyond the primary residence.
Okay. Has this land been in your family for a while?
No, we acquired it roughly a year ago. My wife and I are both from Montana, both attended Carroll and have been trying to get back to Helena ever since. So we've been trying to find a place to live and happened upon this piece of property and purchased it a year ago.
Okay, the ownership question I had is in the Exhibit H of our packet. Did you find it?
I believe, yes. Is it the one with the name of Flax on it?
Yes. And that's, I was questioning, why is the owner of the parcel labeled Flax, George E. and Carolyn Suzanne and Andrew Jacobs and Ellen Cat, and your name does not appear?
I believe at the time that the Department of Revenue had not done the ownership change yet, so that was the name on the parcel until the actual ownership had changed. We purchased the property before that, but I don't know if the Department of Revenue had that change yet. So on that first application, I believe for I believe that's the digging of the monitoring wells, if I'm not mistaken, Jay and Frank.
Yes. Commissioner
that-
Payne, that is true. At the time of the site evaluation, that was the name on the Department of Revenue, which that does update periodically, but at that time, that's just what comes up in our database. So we don't have the ability to just go in and change it right away. So,
Is this the people you bought the property from? Where do you go? There you
It
go.
is. It is.
Okay, okay. Just, inquiring minds.
Yep. No,
That was
I
the
saw that.
only.
I saw that as well and was wondering, I was like, okay, I think it was because the Department of Revenue and the cadastral took a while for it to update.
And if that's the people who owned it before you, that's fine. That was all the questions I came up with.
Thank you, Candace. Sherry, it looks like you'd like to ask a question and
Yeah.
make a comment.
So on the last variance that we voted on last month, the size of the septic tank and the number of septic tanks was a big deal. I don't see anywhere on here if it's gonna be 3-bedroom house, 3-bedroom apartment, or 4-bedroom, or what size septic tank they are required to put in. Is there a minimum, maximum?
Madam Chairman, members of the board. Yes, state of Montana does have minimum sizing for septic tanks. 0 to 3 bedroom structures are required to have a minimum of a 1,000 gallon tank. 4 or 5 bedroom homes are required to have a minimum of a 1,500 gallon tank. And then each 2 bedrooms above that adds an additional 500 gallons. So those, we haven't done our formal design at this point yet, but those tanks will be sized, as will the rest of it, based on the requirements of the state of Montana and Lewis and Clark County.
So if they get the variance, if we pass it, then they have to have another permit to get the septic tanks? Am I hearing that correctly?
Madam Chairman, members, yes, there is an installation permit in Lewis and Clark County that would be applied for. Once the design is approved by the staff, they would issue a permit before construction could actually start.
Okay. They don't have any limitations, do they? Since they have such a big parcel. I mean, they could have a 2,000 gallon septic tank, right? Because they're on 44 acres.
The tank would be sized appropriately for the number of bedrooms in the structure, yes.
Yeah, okay. Okay, thank you.
Thanks for your questions. Anybody else have any more questions or discussion to offer?
Madam Chairman, I have one other a comment I would like to make. We would respectfully request that the one recommendation from the staff that the structure or the living quarters in the shop be personal use only. This, as I mentioned, the system will be sized based on the maximum daily flow for the number of bedrooms in both structures. The wastewater characteristics and the treatment capabilities of the system will not change based on who is in that structure. I feel like it unnecessarily restricts the use of that structure.
Just a little clarification, Jay. When you say personal use only, you mean you just so they're not running a business out of that shop? Is that
Yeah,
kind of what you mean?
correct. Personal use, yeah, for their own. Sorry. Get them on a camera. Personal use for their own use, not to be rented out or used as an apartment, was the recommendation there.
I have a question about that. What would that necessarily matter for the protection of the groundwater if it's rented or just family?
That's a good question. Probably it's more of a safeguard that it would not be used, you know, say if it's permitted as a 2-bedroom dwelling for their use, that it doesn't turn into a multiple, 6-bedroom structure that's rented out with numerous families. But that is just a precaution we've always included. But yes, that is a good point that Mr. Prescar made, that it would be sized appropriately. And when we permit those, it's for gallons per day flow based on number of bedrooms.
More discussion?
Jay, just a clarifying question from, so that I understand the, what I guess what I'm hearing you say is that personal use, for example, family coming to stay for a few days is very different than renting it and having that be used on a daily basis, which puts a different strain on the septic system than if they were to have visitors come or family come stay every once in a while. Is that what I'm hearing, kind of the difference in your description?
Yes, that is correct. That is the thought. Yeah, that you're able to limit the amount of people, but yes, that you summed that up correctly.
Mayor Harris?
Yeah, I guess I'm not getting this one. I don't understand if it's used for rental or used as a single family dwelling. If there's any greater, I can't see how there's any variant in the impact on the groundwater. Whether it's rental and used as, rental for whatever, say they move into a house and later use it as a rental, or if they use it as a single family dwelling, I don't see the variant in the impact on groundwater there. I think I guess I would tend to lean towards the request to remove that stipulation if there's no variant there.
Yeah, I agree.
Thank you for that comment. Shannon?
Thank you, Madam Chair. Jay, are there sort of differing standards under the DEQ4 for commercial properties versus personal use properties?
Could you repeat that question? I'm sorry.
Yeah, are there varying standards under the DEQ4 for personal use properties versus commercial use properties?
There are somewhat, in a case of basically being a 2-bedroom home for residential use versus a 2-bedroom apartment. No, you would
Right.
basically
Okay.
be looking at the gallons per day flow being the same. So the drain field would be sized the same. Now, if that
Okay,
was
so
used for a commercial property such as industrial use or manufacturing of food products, then yes. And
okay, so rather than personal use, residential use perhaps could be an
yes,
appropriate limiting. Okay.
Commissioner
all.
Payne? Thank you so
Ah.
much, Shannon.
Okay, I'm back on this limitation to family. So what if Chase and his family want to have the hired man live out there? They got 40 acres, they need some help. How can we say it has to be limited to family? And when you say family, is that, you know, direct lineage, or if it's my stepfather's third cousin twice removed? I think this could cause a claim of an arbitrary and capricious limitation, which could trigger the dreaded lawsuit.
And just
That's
to
all.
just to be clear, the language says personal use, not family. I think we were using family as an example of trying to describe. So Jay, try to tackle that one more time. Personal use in the recommendation.
Yes, personal, the hired hand living there, yes, that would be considered personal use. And the wording on that probably is incorrect in the sense that Commissioner Brown kind of nailed it. You know, would it be an industrial type use or a commercial use that is different than a living unit? So that's what we don't want, is, you know, some type of use that's not
Like a
residential.
car wash.
Yeah, or a food
Jay,
manufacturing, so on and so forth.
Jay, can you clarify one other, in your original presentation, I thought I heard you say that there would be an initial septic tank for the shop. And then as the plans to build a home were, you know, came forward, that there would be another tank for the second dwelling. Is that, did I hear that right? Is that, or did I have it?
Madam Chair, yes, that's correct. Basically in the proposal from the applicant, they're proposing the proposed house, which if you look at Exhibit F, which would be the lot site layout, it shows a proposed house which would have its own individual tank. To the east of the drain-filled area would be the proposed shop with living quarters, which would also have its own individual septic tank.
Okay, great. Thanks for that clarification. I didn't see
Now-
what hand went up first, but go ahead, Jay. Do you have more to add?
When those are built is not spelled out in the proposal.
Okay, perfect. So I'll just go with Sherry.
Hi.
Thanks.
So I have a problem with it too, with, you know, the state trying to tell the people how they can use their property. I understand the whole commercial thing. If they were to turn the shop and the living quarters into a commercial business, they would be applying, I would think, for a commercial permit, you know, or a business license kind of a thing, a tax ID from the state that might trigger a closer look at how they're using their property. But I think at this point, I would personally just recommend that nobody tell them how they can use their property for personal use or whatever, because it's too broad. What good does it do? Like, why put it in there? You know what I'm saying?
I do. I hear you, Sherry. Would you be more comfortable with the word residential use only?
Well, they are building a shop, which I'm assuming is going to be commercial at some point. But maybe it's just fixing cars where they'll have 2 employees or 3 employees or whatever.
Okay.
Nobody might, you know.
Thank
kind
you,
of-
Mayor Harris.
Well, I think we're convoluting a couple things here. No, personal use thing, to my understanding, Jay, and you could speak to this, it would preclude them using it as a rental, correct? Right there, Jay.
Yes.
Okay, so that's
Sorry,
I think my
Sherry.
concern first and foremost is that we don't preclude them from using it as a rental. Any sort of commercial use, which is different, I think, than a personal use that as a rental, that would require different codes, it would have to be built to different codes and all sorts of things as that. I don't think that I guess my issue is not think there is a variant, especially in usage on a commercial property, and then that could substantially affect the groundwater. But I don't think there's a variant between a rental and a single family dwelling. And I think that as far as the effect on groundwater, and I don't think we should restrict from this entity, which is the Board of Health, the usage of a rental when there is no variant, something a variant between a family living there or a family that's renting a living there. I guess that's my point on this.
Correct. And to state basically the industrial or the commercial use, you're looking at a different traffic flow in and out of that property. You're looking at different wastewater, potentially higher, BOD, higher, different chemicals going into that system potentially. So that's what we typically want to limit with this, because it is a vulnerable area as far as the aquifer, shallow groundwater. So, but the residential use, yes, you are correct in assuming that the flows, the amount of water going into that system should be the same.
Thank you, Jay.
More board member questions or discussion?
Yes, Madam Chair.
Please. Oh, sorry, I didn't see your hand there. Please.
Thank you. Jay, I just want to clarify, did you say that the board in the past approved similar variance requests for the similar systems with similar like soil composition and groundwater levels?
That is correct. The
Okay.
two lots, the one directly adjacent to it to the north and the lot adjacent to that to the north were both approved. Exactly same situation, shallow groundwater. They all failed groundwater monitoring, and they both approved the same type of system, level 2, the elevated sand mound.
Thank you. And then just a comment, Madam Chair, I think, perhaps in the recommendations, there was maybe some imprecise language used. It doesn't sound like anyone was intending or that this body should be adopting a limitation on, perhaps commercial use of a residential space for, as like a rental property or something like that. But perhaps there are some differing regulations for an industrial use. So maybe, if the board were to adopt the recommendations of the staff for that to be limited to the living unit for residential use, regardless of whether that's being used by the property owner or some other entity.
Thank you so much for that. Further discussion. I have just a point of clarification on page 15 of our packet under the recommendation section, where it kind of lines out the bullet points 1 through 4. If the board would please just take a minute to review that and make sure that, and before I ask for that, Frank, is that the official recommendation that we would be making a motion to vote on those points?
Madam Chairman, yes.
Okay.
And like I say, we have no problem with any of those recommendations. They're all going to be built into our plan anyway. It was just the personal use limitation that we would ask be altered or removed.
Would the Board of Health would the Board of Health as a problem solving strategy here be comfortable with subbing out the word personal with residential?
I agree with that. I think that should be part of the motion.
Further
Yes.
discussion on that? Okay,
Madam Chair,
please.
1.2 in this discussion is that this lot currently is over 20 acres. And it cannot go, below 20 acres due to DEQ review.
Sure.
Okay.
Any more questions, comments?
No.
Okay, I'd like to call for a motion if There is one.
I'll move to approve the variance with the variation of the verbiage in recommendation 1 and changing it to residential from personal use.
Thank you, Mayor
Second.
Harris. Thank you for the second, Mayor Collins. I'd like to now call for public comment.
Madam Chair, we do have public present in the meeting today, so I just would like to take a second and let the public know that if they were to raise their hand using the features at the bottom of your screen, it says raise hand. I can see that you're interested in providing public comment on this particular agenda item, and I can then open your ability to provide that comment to the Board of Health at this time.
And sorry, Jinder, will you be watching that for me, or will I be calling on people?
I was watching and I don't see anybody raising their hands.
Okay,
I just
great.
wanted to give them a second in case they were trying to figure out how to raise their hand. So, but it looks like we do not have public comment at this time.
Okay, any final discussion from the board on this action item and our motion on the table? Okay, Board of Health members, please turn on your cameras for a vote, and I will call a vote. All in favor, say aye.
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 Any opposed? Any abstains? The motion passes.
And Madam Chair, I saw that there was something that was typed in the question and answer section. So just for the record, there was a member of the public who gave comment in there that said, give him the shot, ! And I don't know if you all can see that, but I wanted to make sure that you saw that that comment came in from the public.
Thank you for participating to the public. Appreciate you being here. Okay. With that, we will move on from agenda item 3 into agenda item 4, board discussion. Val, I'd welcome you to present to us on the Casper Community Survey. Thank you.
Thank you,
And-
Madam Chair and members of the
and-
board.
Sorry,
can you hear
1
me?
second, Val. I just want to say,
Oh.
Chase, thanks for coming in person. We appreciate you being here. Okay, go ahead, Val. Thank you so much.
Yeah, thank you. Can you just remind me very quickly how much time I have on this agenda item? I want to make sure I respect your timeline.
Of course. We have kind of a lot to go over, but we have a whole hour. I would say about 10-15 minutes. Would that be enough?
Yeah, that is that's perfect. So I'll try to wrap up by 2. I know that we have a couple new members on the board, so I wanted to start out just giving some context before I jump into highlights from the Casper survey report. So every 3 years, the Public Health Department partners with St. Pete's and Peerview and so many other local organizations to do what's called a community health assessment. And that community health assessment then informs our priorities, and that eventually develops what we call our community health improvement plan. And that improvement plan basically lays out our roadmap for what we're going to prioritize and strategize around. So the assessment is sort of this the starting point for that cycle. And it's really intended to take a deep dive and analyze data and community perspectives and stakeholder perspectives in assessing where we're at, what our community health needs are. Have they changed? Have they stayed the same? Do we need to shift? What is the data telling us? And so we look at a number of federal and state and hospital related data sources. But another really important component of that assessment is going and talking to our community members themselves. And so that's what this Casper survey was. It was our door-to-door community-wide survey where we're asking the people living here, you know, what's going on? What are you concerned about? How are we doing? So just with that, we completed that survey in the end of June, I believe. And this report that I'm about to share is just a snapshot of some of the highlights from what we found from that survey. And what you'll see at the end of the year is a full-blown community health assessment that will basically include this information plus a lot of other information. But so this is a rather short report that just focuses on what we heard from our constituents. So unless there's any other questions on that, I'm just going to share my screen. We have about a 10-page report, but I'll try to speed through that rather quickly. I know we don't have a ton of time, but if there are questions, feel free to just chime in. I think I can share my screen, but I'll probably lose my sight of you guys. Can everybody see this?
Yes.
You should be seeing. Okay, perfect. I'm going to go into full screen mode here, and then hopefully it'll be a little bit bigger on your end. Okay, so we actually surveyed members from the entire St. Peter's Health Service area. So that included folks from Lewis and Clark, Jefferson, Powell, Broadwater, and Marr. We had about 20 volunteers, knocked on 838 doors. Wow, I know that was a huge effort. I know some of you maybe helped with that, so thank you so much. And we heard from over 339 folks in those counties. There's a lot of detail here about what the Casper survey is and the methodology and why it's important and why it's helpful. I don't have time to dive into that, but if anyone has questions about that, you can just email me or call me, and I'm happy to answer questions about that. Yeah, this next page is, again, just some deep dives into the survey itself. We did take note of some of the demographics, both from Lewis and Clark, Jefferson, Powell, and Broadwater and Marr. Nothing here really deviates substantially from what we see in the census data. So that was really good to see, because what that tells us is we did a pretty darn good job of getting a representative sample. So we heard from folks of all walks of life, and this was kind of a verification process just to make sure that we heard from everyone in our community. So it verifies that our randomization efforts were successful. Again, not going to go too much into the details of the data just because I don't have a ton of time, but just note that we heard from a lot of different people, and we hit the nail on the head in terms of getting our representative sample from our community. This is a fun page. I know in public health we focus on death and disease a lot. But we do have a lot of things to be proud of, and a lot of folks at the end of the day really love their community here and love living here. 80% actually rated their health as good or excellent, which is a great number. 94% said they feel generally safe. Again, amazing. 91% believe our community is a good place to raise children. 78% believe we can typically get the health care when we need it. And 88% believe that this is a good community to grow old. So those are some things that I think we can really hang our hat on here. We asked folks to vote on what they thought the top items were for what makes a healthy community. And you see those top answers broken down here: access to healthcare, affordable housing, good schools, healthy economy, and low crime. Most serious health concerns that really rose to the top: 64% voted that alcohol and substance misuse is a major concern in our community. 47% said that mental health, and that sort of tied in also to depression and anxiety. People specifically called that out. And close to 20% identified lack of access to healthcare as a health concern. This page is just a summary of some behavioral and mental health related questions that we asked folks. One thing that I want to point out here that I thought was maybe not surprising, unfortunately, but did still shock me to see that 37% of the people that we spoke to reported that their mental health was not good for either several days or more within the last month. We know that behavioral mental health is a concern. We hear that time and time again from our stakeholders and from our community members, but that was something that really stood out to me. Okay, I know I'm moving through this pretty quickly, so if there are questions, I can't see everybody, so just let me know if they pop up. This is really the last page. We just broke down some questions specifically related to access to healthcare. Another number that seemed a little staggering to me was that 39% of the people that we spoke to said that they either delayed or chose not to get healthcare when they thought they needed it. And some of the top reasons for that were that they either could not get an appointment, the wait time was just too long, or they were worried about finances. So they were either uninsured, worried that insurance wouldn't cover it, or that it just would be too expensive. One thing that was unique to Broadwater and Mar residents that wasn't necessarily the case for Lewis and Clark is that, not surprisingly, services are not close enough. So they have really long travel times. And you can imagine if you're in the middle of Broadwater or Mar County in the wintertime, it's just really difficult to get to services in Helena or other major cities. That is all I have. Again, that's just a really quick rundown of what we heard from our community. You will be seeing a fairly robust report coming out at the end of the year that takes into consideration a lot more data sources and information from our health professionals and stakeholders. Before I stop sharing, I guess I'll just pause and see if there's any questions from the board.
Not me.
I can't see anybody's screen, so just go ahead and ask away if you have one. Or
Hey,
comment.
when were these data collected? During like what time period?
Yeah, so there was 1 week in the end of June of this year that volunteers hit the road and went door to door. So it was a point in time survey. And Brenda, I don't know the exact dates, maybe you can help me out, but I think it was like June 25th through the 28th or something like that.
And this was done primarily through like informational interviewing. That's how the data were collected.
Yes. So the survey was approximately 35 questions. And so the volunteers were trained from state employees and CDC. The CASPER methodology was created by the CDC, so they helped us out, trained our volunteers, and they were face-to-face interviews with members.
Thank you.
Yeah, thank you for the question.
And Shannon, the dates that we did that were June 24th through the 28th.
Thank you.
Yes. Yeah.
Well, it sounds like that was worth the work. I remember those were very hot days for you guys all out there hitting the streets. So thanks for all the effort, and it's really, really nice. Sometimes we sing to our choir, we speak to the people that we have connections with. So nice to get random sampling from across our community. So way to go, you guys.
And Valerie, before you wrap up, I think that it's important for the board to hear your thoughts on the data dashboard that you're envisioning. I know that the timing on that will be sometime down the road, and you're still putting some some thoughts around the development of that. But what I heard you say is that all of the data from the CASPER will be available through that data dashboard. Did you want to talk about that for just a second?
Sure. Thanks, Trenda. Yes, so the timing of that is TBD. Web development is time consuming, and I'm simultaneously putting together that community health assessment. So I'm not sure if it will be done by the end of the year, but if it's not done by the time that final assessment gets published, you should see it in the very early beginnings of next year. And that dashboard will, the vision behind it is that it'll be a one-stop shop for our staff, for our public, for you all, to be able to explore all of the data, all of the information that we're looking at when we're writing these reports, so that you feel like if you wanted to take a deeper dive into looking at what we're looking at, you can, and that it's accessible. So yes, you're exactly right, Drenda. The report is just what stood out to me as a data analyst. But if you wanted to say, hey, I want to look at all of the questions you asked, and I want to see how all of this breaks down, we just can't do that in a short report and trying to keep it manageable. So yeah, that dashboard will be a way to display all of the data points. So I'm excited for that. I'm looking forward to that, and hopefully, hopefully that'll be coming soon. It's always been a passion of mine to make sure that we continue to improve on our transparency and the accessible nature of the data that we collect as a health department and also as a community. So yeah, stay tuned on that. Thank you. Thank you for the question.
And then, Madam Chair, if there are no other comments or questions from board members, there was one that came in from the public specific to the CASPER. So I can address that once the board is done asking their questions and having their discussion.
Thanks for alerting us about that, Drenda. Any other board members have comments or discussion? For me, I think just to add a comment in is just, one, Val, nice work on your presentation. That was awesome. Way in a snapshot for you to share that data with us. It's really interesting. Well, it's really hopeful what the positive feedback was of the strengths. And then I also find it interesting, and not surprising that we just still have such gaps in the whole behavioral health substance use care, healthcare continuum. And so, helping us always remember that's part of public health is really important on all that goes into the prevention of later mental health and substance use, which can tie into one of my old favorite subjects was adverse childhood experiences, and making sure that, everybody from age 0 or -1, is included in our visioning. So thanks so much for that good work.
Thank you, Madam Chairman.
And I'll just, as an added reminder to the very last page of the report that Val just shared, this is not done just by Lewis and Clark Public Health. We have a steering committee that works together on both the community health assessment and then next year, the community health improvement plan. And so those partners include St. Peter's Health, Pureview Health Center, Rocky Mountain Development Council, United Way of the Lewis and Clark area, and Public Health. So we are working in collaboration with our community partners on both the data collection and the community health assessment that will be completed and published by December. And then to answer the question from the public, which the question specifically states, what kinds of policies or interventions do you plan to implement in the community based on this data collected? So we will not be making those determinations as a single entity or as the health department. We will be working with our steering committee partners and then also facilitating a broader community discussion. And that happens after the community health assessment is completed and published in December. So you can look forward to seeing information come out about an invitation to the community health improvement planning process after the first of the year. In the past, we have done 3 to 4 facilitated discussions with community partners, with the public at large, whomever wants to participate in those discussions. That process starts with a review of the data, and then priorities are identified, and then from there, policies, interventions, programs, strategies to address those priority areas are then defined. And so it is a wide open community process that occurs, and it will be happening after the first of the year. So for those that are interested in participating, watch for those invitations to go out to the public.
Thank you. Okay, thanks again, Val. And we are moving into our Aging Well Initiative presentation with Karen.
Good afternoon, Madam Chair. Can you hear me?
It's just a little muffled, but we can hear you okay.
All right. Is this a little bit better, Madam Chair?
It's fine. We'll be okay.
All right. Well, thank you. Let me just pull up my presentation. Okay. All right. Thank you so much, Madam Chair and members of the board. My name is Karen Plain, and I am a health coach in the Tobacco Prevention and Cessation Program. I also am the co-lead of the Aging Well work group, which is what I'm here to talk to you about today. And as a reminder, the Aging Well work group is a subset of the Healthy Communities Coalition, which I also have the good fortune to lead. And Healthy Communities Coalition started in 2014, and it looks at policies and programs, environmentals and system change about how to make the healthiest community that we can. And so looking at, all right, so looking at this work group, we have had, since Healthy Communities Coalition started, a few different work groups. None have had the level of engagement that Aging Well has had, which I think is very telling and interesting. So we meet on a monthly basis. The Aging Well work group meets on a monthly basis. The Healthy Communities Coalition meets quarterly. So we meet 4 times a year, whereas the Aging Well work group meets every month. And as I said, I'm a co-lead of this work group. Our other lead is Mindy Dale, and she's from the Rocky Mountain Development. Let me just see the presence. Okay. All right. I'm getting some feedback that you're not being able to hear me very well. Madam Chair, what should I do? What would you like me to do?
So Karen, I wonder if your audio is going through your computer. It sounds like your computer's picking it up and your laptop's closed.
Okay.
So do you have if you just go down to the lower left-hand corner of your screen where it says audio and select if you have a different, do you like your camera? Does your camera have the microphone on it?
Can you hear me?
No, try again.
Hello, can you hear me?
Still muffled.
Yeah. What options do you have under microphone when you click on the little arrow for audio?
HP E243 audio driver and speakers Realtek audio.
Okay, so it doesn't sound like, so is your laptop closed?
Yes.
Okay, try to open it.
Okay.
It'll mess up your screen, just so you know. You'll have to kind of rearrange. But I think that's what's going on, is that using your microphone inside your laptop and your laptop's closed. So.
All right, how is this?
Perfect, much better.
Okay. All right, thank you, Mayor, for the feedback. I appreciate you letting me know that. So let me try again here. Thank you for your patience. Let's get back to this. Not what we wanted. Okay, so as I mentioned, I am a co-lead with Mindy from Rocky Mountain Development Council. At Rocky, she leads the senior nutrition and transportation programs. And so you'll see that we have a wide range of members from all different types of organizations. But I would say that these ones that I've listed are the ones that show up regularly, you know, almost every month. And so it's, of course, Rocky, since Mindy is our co-lead, we have really good representation from the VA, our partners at Mountain Pacific, AARP, St. Peter's Foundation, the City of Helena, and then we also are really fortunate to have some volunteers that are super engaged and show up. All right. All right, so as I mentioned, we have monthly meetings. I just wanted to give you a sense kind of what those look like. And so we often have, or I guess every time we have subjects presented to our group so we can learn more about various subjects that impact those folks aging in our community. Some examples of those include the seniors farmers market program, the caregiver support program from the VA, Meals on Wheels, and congregate dining. St. Pete's Foundation last month presented the benefits of volunteerism. And then we also had someone from the Office on Aging, the Legal Services Developer Program, and they spoke to us about kind of getting different legal documents in order. So not only some how-tos, but more importantly, how to connect the folks that we work with these resources. So beyond you know, learning from experts in relevant subjects, we also have, excuse me, one second. We also have a part of the agenda set aside so that we can share the projects that we're working on. And often we ask for collaboration and kind of troubleshoot during this time. And so again, like I said, it's a really engaged group. There's nothing worse than running a meeting, as I'm sure many of you would agree, with kind of no questions or no discussion. That's not the best feeling. So I really look forward to these work group meetings because we are such an engaged group. All right. So I just wanted to highlight one thing, one of the things that we're kind of proudest about, and that is, let me see here, our age-friendly designation. So Aging Well work group started in 2019. And since that time, almost from the beginning, a goal was set forth to see if we could get communities in Lewis and Clark County in particular to have an age-friendly designation. And so this is having membership in a network, and I'll explain a little bit more about that in a bit. But like someone else said today, the work in public health can sometimes take years and years, and so it's very rewarding when we achieve one of our goals. And so the Helena City Commission passed a resolution on July 15th to submit an application to join this network, this age-friendly communities network. My understanding from the city is that application hasn't been submitted yet, but that's in process. So what this is focusing on is fostering communities that are well-designed, age-friendly, that they foster economic growth. And we're really hoping, the goal really is to have a happier, healthier residents of all ages. We heard from city commissioners that they were motivated to join the network since it really aligns very well with the work that they're already doing in terms of being age-friendly. This includes things in the city like wayfinding, a complete streets policy, and some other things that the city's doing. So there was really understanding that this made a lot of sense for the city of Helena. So thinking about more closely about the membership in the network, so what does it get you? So the membership in the network helps local leaders identify and understand community needs. It also serves as an organizing structure for making community improvements. It fosters partnerships and local stakeholders, which we know in our work is so incredibly important. And then in terms of the community, what it provides for the community is public recognition for committing to becoming age-friendly, and also helps highlight resources available for assessing community needs, and access to technical assistance and expert-led webinars and other trainings. So, you know, we were very pleased to get that resolution passed, and we are certainly hoping to expand that. We're hoping that it's something that Lewis and Clark County might consider. And here's a picture of our partners with AARP. This is Nancy Anderson, who is the outreach director of AARP, and two of her volunteers. This is after the resolution was adopted on July 15th. All right, well, that was my presentation. Sorry for the hiccups there. I appreciate you sticking with me. Are there any questions?
It doesn't look like we have any questions. So
All
thanks
right.
for the presentation. Nice work. And
All right, thank you, Madam Chair.
okay. We are on, I guess it's me now, our NALBO Board of Health Effectiveness Assessment. So Drenda's going to kind of set the stage, and then I'm going to be facilitating kind of a mix between some just basics and a little discussion about board governance and effectiveness for us all as a governing body. Go ahead, Drenda.
Thank you, Madam Chair. And I don't have the board packet in front of me, so I'm not sure. Can somebody say what page this starts on in your board packet? There are just a few handouts that are in there for you.
There's no page number online.
Okay. So it's it'll be
And it's like page
77?
76-ish,
okay.
75-ish.
So it'll be just after the Casper. It should be just after the Casper assessment report that Val talked about. Should be the handouts for NALBO. Yeah, thanks, Bree.
We're on the same
So-
wavelength, Cherry.
Yeah.
Perfect.
Good.
Yeah, thanks for your patience with the packet debacle that we had this month. We'll work to make that better next month with so that it's not so difficult for you all to get the materials in advance of the meeting.
We all miss Jolene, especially you.
Yes, yeah, we're in transition, and I actually at the end of the meeting, I'll take just a second and introduce Sandy. She is on today, so I'll just start by briefly talking a little bit about what this assessment is and why it's important that we do it and what those functions are. So NALBO is an acronym that stands for National Association of Local Boards of Health. And this is a national association that provides a lot of good training and technical assistance to boards of health like yourself all across the nation. And one of the things that they have offered up is this board assessment. And the board has done this exercise where you have discussed and talked about the different functions in the last couple of years. And so also in your packet are the notes from the discussion from last year. I thought that that would be helpful to add to the packet so that you can refresh for those of you that participated in that discussion last year. And then for our new board members that weren't here with you last year, give you all some context of what was discussed last year. And so these governance functions are essentially what NALBO considers to be priority when it comes to your oversight of the public health work that occurs in our county. And so those functions include policy development, resource stewardship, legal authority, partner engagement, continuous improvement, and then oversight. And so we'll start with policy development. I'll give just a little definition, and it's in your packet, but I'll set the stage by giving a definition, and then I'll pause, and Bree will take over from there and facilitate a discussion among you all of what we have done well and where we might have some areas for improvement in that particular function. Once we're done with the policy development function, we'll move on to the next one, resource stewardship. And we have, just about 45 minutes to have this conversation. So I encourage you to, to kind of really dig in and provide your perspective, ask the questions for those of you that are new to the conversation. So we'll go ahead and get started with policy development. So this is the board's responsibility to lead and contribute to the development of policies that protect, promote, and improve public health while ensuring that the agency and its components remain consistent with the laws and rules. So this policy development, I'll just start you off by giving an example. The Board of Health has adopted a handful of regulations, and one of the regulations that the Board of Health has adopted is our on-site wastewater regulations. And so at the beginning of this meeting, you all discussed a variance to those on-site wastewater regulations. The regulations are there to protect groundwater and our environment when we have septic systems going in the ground for septic disposal out in the county, outside the city limits. Those regulations were adopted in alignment with the state rules as well. So the DEQ Circular 4, those are the state regulations or the state laws that we have to follow. And so ours at the local level aligns with and does not conflict with. So in policy development, that is one example of work that you all have done to protect and promote and improve improve public health in Lewis and Clark County. So I'll pause there. I'll let you all have the discussion. I'm going to take some notes about the areas in this particular function that you think that we're doing really well in, that you all are doing really well in as a board, as well as we as a health department. And then also please identify areas of growth, opportunity for improvement. So.
Thanks, Trenda, for setting us up. And I think we should anybody that's able to turn on your cameras, let's not make this formal. Let's just chit chat. And as people want to speak up, please feel free. Being aware that we've got some newer members with us, I think it's completely fair to think about your vision and some of the reasons why you're volunteering to serve on this board. And it'd be a great time to just, hear some of what, you're excited about in this role or what you'd like to see. And just let's have a nice discussion. So related to policy development, just to get us off, I would just say that, there's been a lot of shifts with the Board of Health over the last, few years on kind of how we work and change. And I feel like this body has been really flexible and adaptable to changing policies and different kind of levels of decision making that's shifted, and just kind of starting to taking it step by step as the once the session decisions were made and the Board of Health rules were adopted or adapted a bit. So I would say that that's a big strength of ours. I would like to open it up for any other strengths, then we can talk about goals or any sort of weaknesses that we'd like to address and think about.
So thank you, Madam Chair. I guess whenever I think of policy development, my initial thought is looking at as someone who's new to the board, the strategic plan that was adopted by the previous composition of the board for the years 2023 through 2026. And I think that those 5 initiatives included in the strategic plan, are sort of the ongoing sort of high level policy priorities of this body. And, that's, I think, probably important for all of us to remember sort of what our role is as, stewards of, the public health infrastructure for the city and county, and how those strategic initiatives are moving those goals forward. That being said, I think I would really appreciate sort of, as we move forward in our meetings, all of the agenda items that we have, sort of identifying what strategic initiative is being, served by that particular effort by the department, or sort of like how it's facilitating the board's, direct involvement with executing those initiatives. I think those are set, right? Like they are what they are until 2026. And I think that they're, great, and obviously are related to sort of best practices, I think, probably as we see across the country. So making sure that we're able to evaluate the department's work in executing those in a really direct way, and sort of tying the ongoing initiatives that we're being briefed on to those efforts, I think is something that I think of, top of mind when we're talking about policy.
Thank you for that. Very, very great comment. When Brenda and I were in Nashville, we had a conversation about this very thing. So I think helping our strategic plan is massive because the health department does so much good work. So I really love that idea, and I'm grateful for you to bring it up. Other strengths in policy development? Okay. Well, is there any areas where we'd like to focus on, or weaknesses we'd just like to bring to the surface, and or goals for moving forward this next year, knowing that we'll come back around to this conversation this time next year, something we can touch back in on?
If I can, Madam Chair.
Please, please, thank you.
Yeah, I would really like to, in part because it's sort of an area of familiarity for me, but also as, strategic initiative number 2 being behavioral health, given the update that we got from Val regarding sort of the sort of high incidence of behavioral health, lack of behavioral wellness or mental health in our community, like I think that really being conscientious about how we're achieving that and how we're moving that initiative forward, I think is really, really important. And I just wanted to sort of highlight the fact that that is one of our ongoing initiatives, and that it sounds like from the update that we got today, unfortunately, that's something that is probably a high priority need for a lot of people in our community, and a large percentage of people based on the update we got from Val.
Agreed. Mikhail, it looks like you're talking. Dr. Bedell, but you're muted.
Sorry about that.
Thank you.
I just wanted to echo Shannon's previous comments. I like that thought of trying to align some of our strategic plans to the agenda, just to kind of keep that, little more toward the front of our minds as we go through the year. I think that's a nice way to kind of keep bringing some of these issues in the strategic plan to the forefront, in addition to the particular conversations on certain areas.
So in all of your free time, Jordan, if you could completely reshape the, the way that I think that we're both aligned on that. So I look forward to more reminders about the strategic plan as well, and where we're at, and any sort of barriers, even if we're not able as a board, this board, to remove them, just be kind of aware of what holdups are, so we can use our spheres of influence to help continue to do our jobs. Okay, unless there's anything else on policy development, Dorinda, I'd like to welcome you to also feed us any sorts of seeds or input that you have for us, please.
Yeah, before we move on to resource stewardship, I'll just add under policy development that the board will have an opportunity in this upcoming legislative session to participate actively in state lawmaking that impacts positively or negatively impacts public health and not only the work that we do at the local level, but the obligation to protect the public's health. And so that just keeping that kind of top of mind as we creep up to the end of this calendar year with a new legislative session starting in January. So there'll be opportunity there for participation.
We're ready for it.
Excellent.
You've been priming us good. Thank you. Okay. Great. Let's move on to resource stewardship. I can just read it for you, Dorinda. So with resource stewardship, we assure the availability of adequate resources, whether they be legal, financial, human, technological, and material, to perform essential public health services. These may include, but are not limited to, these following bullet points, but really overarching facilities and legal resources, developing agreements to streamline cross-jurisdictional sharing of resources with neighboring governing entities, developing or approving a budget that is aligned with the identified agency needs, engaging in sound long-range fiscal planning as part of a strategic planning effort, exercising fiduciary care of the funds entrusted to the agency for its use, and advocating for necessary funding to sustain the public health agency activities. So this is a big one too. This came up a lot over the last year in our conversations as a Board of Health, as the work we do is sometimes not as well funded as we would necessarily need it to be. To address all the needs we see in the community. So let's start with some strengths about how we as a Board of Health have supported our local public health department to do a good job with resource stewardship.
Well, I think I know we had an update from Drenda on the budget from our last meeting, which, required some really difficult and unfortunate sort of budgetary restrictions and sort of a reduction in the budget and a reduction in staff. And so I know that obviously there are a lot of competing interests that required that. And I know that was really positive news from a budgetary perspective, for a lot of the members of the board. But I'm also struck. So I think in a way that is a strength, I think could be viewed as a strength in so much as ensuring, a prudent use of the available resources. But I also was struck by, the account of the fact that the public health department is outgrowing its space, and that obviously the population of the county is continuing to increase. That requires more services, more human resources, more technological resources, and I think that there's probably going to be some uncomfortable growing pains in the future. And we're going to have to probably figure out how to address that, as population growth continues. And I think that, in this particular section, I think there's maybe, I don't know, Drenda or Bree, if you had a chance to get briefed on sort of like, advancing technologies in the world of public health, but I think this is a great opportunity to discuss the ways in which, evolving technology can be used to reduce sort of the manual, like what has historically been manual operations within public health. And when we're talking about the sort of things that the department has to do statutorily that we don't have an option, or things like that. And so, maybe with an eye toward, as we're talking about resource allocation, leveraging emerging technologies in order to automate as much as we can, and sort of invest in that aspect of development, so that the more the aspects of public health that require that human interaction with members of the public, we can invest as much into that as possible, while also using technology in the aspects of programming that don't require that.
Thank you. Go ahead, Commissioner Payne.
I wanted, in response to Shannon's remark about our public health, and I'm sorry if I misunderstood what you said. I think you said that you recognize the need for more space. And this is something we've struggled with, because more office space costs more money. And Drenda took the drastic step to move the entire department over into the Murray building, emptying space and saving this department rent. So it's not popular, but it is real. And we've got a huge problem with property taxes and people being mad about it, and they're objecting to it. And when they do that, the commissioners have to listen. And I really admire Drenda, because she's out there chasing grants, but we still have to be realistic on the amount of money we have to spend and the resources that need to be supported through, we get $1, it's got to go to several different priorities, and that's part of, that's what the commissioners do. So that's all.
Thank you for that comment. I think another positive, another strength that I've seen and heard, and I know it's even kind of, as we continue to think about streamlining and what is the role of the health department versus where could we partner to support other agencies to do certain work. It's a scary thing to see out loud, especially, I mean, I when I used to work at the health department as a public health nurse, I remember hearing about Public Health 3.0, where all the programs, moved to nonprofits unless there was no program available. And I used to really not like that, because I love working at the health department. But I know that Drenda's, she's being realistic, and I appreciate that, thinking about who's the expert, where's the work happening, how might we partner and support that work. And I just will say this, I'm such a huge cheerleader for the coalition management leadership ability to pull a group together that our local health department has, just really, really solidly able to bring partners to the table for a purpose. And I think that's a great use of, our staff time, the face-to-face work. And I would just like to say that's a great strength. And then another like data point that I would say with good resource stewardship, it might be kind of like a far out, but as our accreditation, what is the define? We're exceptional. We're something very good. Trenda, what was the word?
Yeah, exceptional health department is
We're an
exactly.
exceptional health department. And,
Exemplary.
and so that's really wonderful to hear. And so that means that in the limited amount of space and time and money that the folks that are employed at the health department are giving it their all. And it's really showing up both on paper and, in comparison to other health departments across the country. So I think that's a great data point about resource stewardship, that everybody's doing a really good job, even when it's tough.
Yeah, and Bree, I just wanted to echo Commissioner Payne, who did mention the grants. The health department has done a great job going after alternative resources that aren't directly coming from the taxpayers in order to support many of the things they're obligated to do. And then kind of skipping down, as you mentioned, the partnership. They've done a great job, usually in leadership role of bringing other agencies and groups together to facilitate much of the work that we're required to do. So,
thank you. We've kind of gone back and forth, but any goals or visions or anything we should put on the table for more weaknesses related to resource stewardship, or anything people would want to mention on that side of the conversation? Or even threats?
Well, coming from the medical side of things, and this has been brought up previously, looking more toward various payer sources, insurance, programs that are supported through insurance payments and so forth, which I think they've, continued to do a good job of seeking those out, but looking for areas where resource can be found.
Absolutely. And this is another section where we can champion the what we're hearing as a upcoming coalition of several of the public health organizations around trying to get more resources to support the work of our sanitarians, because it really can't just all come from property taxes. And I know we've gone in and out of this many times, but there's just, we need to figure out a solution to bring more resources to that work, especially as Helena grows and we want to see safe, healthy establishments. So I'll just say that when Drenda tells us that there might be an opportunity to engage, that I hope that you'll consider if that's something you like to do to engage as a citizen up at the legislature, because it sounds like that's going to be work that will be happening and could really help next time we go around this conversation around budget, because that was a tough one. Do you want to add anything, Drenda? I feel like I just did a little, I didn't really articulate that well, but.
No, I don't have anything more to add. I think that you all captured resource stewardship very well. I think we worked over this past year in particular to really address budget shortfalls with increases in those expenses and not having an increase in our revenue, and still being able to maintain our ability to do the work that's important and that's required. But to your question about threats, I am concerned about future years. If we have to continue to cut without added revenue, we won't be able to maintain the necessary capacity to do the work that's required in this county for public health protections. So I think that is a threat to us as the years go by. And something that we will all have to be working on together.
Mm-hmm. Yeah, thanks for bringing that, and I welcome you to continue bringing us data points we can put in the notes and just continue to capture the day-to-day struggles that might come up as our community grows and there's not capacity. So we can kind of maybe start to get ahead of that, or at least be aware of it as it happens, and hopefully a solution emerges for us. Is everybody okay if we move on to legal authority? Okay. Moving on to legal authority, I'll just kind of for time's sake, if people will just read that section to themselves, the bullet points, but really this is our exercise legal authority as applicable by law and understand the roles, responsibilities, and obligations and functions of the governing body, health officer, and agency staff.
And for local context, this is Title 50 in the Montana Code Annotated that describes specifically the legal authority of the Board of Health, the legal authority of the health officer, and then the work the staff does on behalf of the health officer and the Board of Health. So Title 50 is your reference point for this.
I would just say that we all seem to work really hard to do our duties, and I'm curious what other, just to kind of tie in, I know we don't have very much time, but hopefully this is a worthwhile question, is should we get to the point where resources limit our ability to carry out that mandate? Do you see that as something we are gonna have come up, Drenda? Like if we can't keep up because of a small or
Yeah, so one of the things that we are mandated or required to do, for example, are those restaurant inspections. And if we don't have resources to have adequate sanitarians on staff to do it, we won't be able to meet our statutory obligations to do the work. So there is some overlap, of course, in all of these categories.
Yeah.
We'll have to continue to keep an eye on, are we meeting our legal obligations?
Well,
And
hopefully we can make it some really strong case points to the legislature about why it's important to make sure that we have good public health programming. So any other on legal authority or those issues that anybody would want to bring up? I'll just kind of open it up to anything, and we'll try and cruise through.
I'd like to make one point under legal authority, because back 2 sessions ago, there was the change in the governing body. So the Board of Health no longer is able to adopt regulations. How they are only able to make recommendations to the governing body to adopt. And so that also includes situations where the existing regulations that we have on the books, when those come up for review and edit and adoption again, that the Board of Health is only able to make recommendations for approval. I think we all worked really hard to create a process that streamlines that fairly well. We do have 2 county commissioners, including Commissioner Payne, on that governing body. We have 2 city commissioners, including Mayor Collins on that committee or on that governing board. And then we have Mayor Harris from East Helena. So 3 of the 5 members of that governing body also sit on the Board of Health. And I think that that's really helped to streamline the fact that we have yet that extra step that we have to take now when there's any regulations that need to be adopted or reviewed and edited. So I would say that under the circumstances and the fact that the law has changed and that's a requirement, that we've done our darndest to make that a process that's not overly cumbersome. The members of the governing body can certainly speak up and have an opinion about how cumbersome they feel it has been, but from my perspective, it's not been too bad. We figured out a way to make it work.
Okay, thank you. For just time's sake, Brenda, do you want me to do the second half of this at another meeting? Should we run through it? Would you want to make because I think talking about the community events also really valuable for this time. So could we finish this next meeting? Do you think there'd be time or?
I will build it into the agenda for next meeting so that the board has adequate time to discuss. I would hate to see you all rush through and not have robust conversation. So we can just add the final 3: partner engagement, continuous improvement, and oversight to the next agenda. And you can just continue the conversation in October.
Thank you. Okay, with that, then we will move into the number 5 agenda, Invisible Shield documentary.
Yeah, and so we did have a board member attend. Sherry joined us for the September episode 1 of the Invisible Shield. We had about a 35 or 40 attendees come. Which was actually not too bad considering the fact that that was the same night as the presidential debate, which we knew was going to be a conflict and was going to cause some issues. We had our dates set well before, but you know, when it comes to presidential debates, they don't care what we have going on at the local level. So I was really happy with the turnout. There was an added event that was concurrent with ours. We partnered with the Montana Vaccines for Kids Coalition. They hosted a legislative reception prior to the showing of the episode. And so we had a really good group that had come to discuss the importance of vaccines and what it will mean to advocate for vaccine requirements come the next session. We had legislators that showed up and had good conversations. There were medical providers there. A variety of community members there, and most of the individuals who came for the reception joined us for the first episode. So the first episode is the name of it is, or the title of the first episode is The Old Playbook. And so it really went into the history, kind of where public health started, and where we've evolved from in some cases. We had a trained facilitator that once the episode was done, really did a good job of facilitating a conversation about the things that we all learned together. She really encouraged the attendees to kind of push back on the material. What do you have questions about? What do you have concerns about? What didn't you agree with? So there was some good conversations there. Sherry, feel free to jump in as far as the conversation is concerned. It was pretty public health friendly. There was not a lot of dissension in the room. I think we can do a better job of encouraging voices from varying perspectives to show up and participate in the conversations, because that's when we're going to grow. But it was a great opportunity to learn together. The documentary itself is available and can be watched now on PBS. So members of the board who were not able to join us in September, you can certainly watch that episode and then join us at the October episode. Before I talk about October though, Sherry, what would you add?
Yeah,
Since you were
so I have a few comments on that. So the reception that happened before, was that open to board members about the vaccines?
Yeah, so I didn't do a very good job of letting folks know because I wasn't sure if it was by invitation because it wasn't our event. And so it wasn't clear to me until afterwards that the Vaccines for Kids Coalition would have been more than happy to have folks there. They really took the lead on the invitation for that event. And then I just tried to usher folks from the reception area into the episode. So so I wasn't sure at the time who was invited or who should have been invited. So I didn't do a very good job of letting
Yeah,
the board
I would have
health
loved to
know.
have been there for that.
Yeah.
So my other comments are the presentation itself was very educational about the how boards of health got started. That was really good for me as a new member to see how the history of that. I thought it was really good. I had a feeling in the room that we were preaching to the choir, that it was mostly health board people. There wasn't really much, I don't know if there was any public there. Maybe those 2 young girls from the high school was about it, you know. So really, there just wasn't a lot of Joe Blow public there to watch that. It was, like I said, kind of preaching to the choir. But I thought your facilitator was excellent. I don't know where you found her, but I thought she did a great job before and after, facilitating questions and whatnot. And there was good discussion afterwards. It was good for me to hear from some of the professionals, their take on all of that. And the common theme was they're not getting funded. That if a health department does their job too well, people tend to forget about them, and that funding kind of dries up. So that seemed to be across the board to all the health professionals, which weren't just from Helena, they were from out of town as well. So that is a problem, I guess, no matter where you're at. In Montana, it's lack of funding. So I thought that was good for me to hear as well, that we just come to expect clean water, soil, and air. We don't realize how much work it takes on a health department's staff to make that happen. So, yeah, it's my only comments. So,
Thanks.
So I'll go to the rest of them. I want to see them all.
Yeah, so here, I'll just share my screen. Here's a reminder of, well, maybe, it doesn't seem to want to be loading. It's in your packet. The next episode is the 8th, October 8th. And the theme of the episode is all about data. So in October at the Myrna Loy, starting at 6:30, again, we'll do the same format. So an hour of screening the second episode, and then another hour of facilitated discussion. And we will have the same facilitator, Chantel, will join us again, and we'll facilitate the conversation. I really do encourage board members to join us, and please help us bring kind of those average Joes, right? We want the public to be there. We want this to be an opportunity to learn together, to have these discussions, to hear varying perspectives on what our community is thinking and considering. And it's just a really great opportunity to have kind of open dialogue. And so I'm asking that board members help us fill that auditorium and bring people to the conversation that wouldn't normally be there. The first episode, the folks that are in the room are typical public health people. There are, you know, a handful of medical providers. There were some folks from DPHHS, so the state health department. We had a handful of our staff there. So I do think that it's going to be really important if we truly are going to achieve our goal with this, which is to help shift perception of public health in the community. That we need community members to be there to have these conversations alongside our public health folks. So October 8th at the Myrna Loy, starting at 6:30. They do have concessions open, so we were hoping to 6:30, picking that time for families to get dinner cared for, but they also have, you know, popcorn and refreshments.
Popcorn
and things
for
like that.
dinner.
That's
Popcorn
right.
and kombucha.
So yeah.
Thanks for going, Sherry. I'm planning to be at the next one, and I hope to see some more faces. It'll be great to meet you in person. Okay. I'd like to move into number 6, the public comments on matters not mentioned above. Thanks for those who joined us today. Anything you'd like to add?
And just as a reminder for the public who did join us, if you raise your hand or even type into the Q&A box, those are both good ways to get your comments heard.
Okay, not hearing any. I am thrilled to say that was a nice full agenda. Thanks everybody for your flexibility to move that discussion to next month. So we will be able to end on time, and I will call this meeting to adjournment 2:57.
Thank
Thank
you.
you,
And
everybody.
I guess I should have asked for just 1 second before you
Oh.
adjourned, but
Oh,
that's
sure,
okay.
sorry.
I just a reminder and a thank you. Thank you for all being online today. I am out of town. I was at a conference and wasn't able to make it back to Helena. And so it was easier for me to just join online. And then also Sandy was able to help today because she joined
Oh,
online as
right.
well. So
Sorry,
she's not,
Sandy, I forgot. We're gonna meet you today.
yeah, she's not on anymore. So she must have stepped out. We will make sure that she gets introduced. And next month we'll be back to normal. So in October, for the October meeting, we'll be back in person and then have the hybrid option for those that that need to log in. So should be back to normal, but thank you for the flexibility today. I really appreciate it.
No problem. Okay, everybody, take care. See you next
Bye-bye.
month.